Missouri Health Connection is a secure system that allows us as consumers to have our information shared with those who need to have it in a way that's protected, private, and used in the way that it should be used.
Last December, I woke up and I had a bloody nose. And within about a 15-minute period, I'd soaked 2 towels. My first thought was to go to the emergency room, but the first one that I went to didn't feel that they could handle in a situation like this. So they sent me to a second emergency room where I spent the night and was sent home the next morning, only to have it start again.
I think when families are stressed and under pressure, having the Missouri Health Connection would be a lifesaver.
Within I would say half a day, I'd been in 2 healthcare environments and still hadn't gotten a very dramatic and scary health situation taken care of.
So my dad, who had gone to his local hospital, repeatedly for care over a course of years, but then had an incident happen at home and was taken to another hospital where they didn't know him, they didn't have his health records.
A lot of people have very complex medical conditions and even mental health conditions that really require coordination.
And I think because of those circumstances, it delayed the type of care he would have received. Had they had an electronic health record that was able to connect to one another, I think it would have sped things along a lot better and helped in his care.
I think having the electronic medical record there, at the point when I reached the 3rd emergency room, would have been very helpful, because at that point they were relying on me to tell the story yet again, and by the 3rd day in, I was really emotional. I was tearful, I was scared, I was worried about my children at home.
The personal frustration for me was the time-consuming factor of having to retell health information over and over again at each interval. Information that really they should have had they been connected or had a resource where they can share that information.
Right now, our healthcare system really does expect too much of the patients who are trying to access it. So putting the responsibility of keeping all of these records collected and together and available right when patients need it seems like the right thing to do.
So my dad, who was my best friend, because he had an incident that happened at home early in the morning, he needed emergent care and was taken to a hospital that was closer into town. I wasn't the best person to give information at the time because I was so upset, and my mom, dealing with some memory deficits, we both really tried, and it was difficult.
If I were suffering some kind of emergency crisis, especially if I'm not able to speak, I would want them to have ready access to what's been going on with me in terms of my own personal health.
Having the Missouri Health Connections electronic health record accessible, it would be a stress reliever for us. It would provide the care that Dad would have needed in a more timely manner. And I think that for the providers, it would have taken the stress off of them because they would have had the information they needed in order to move into action really quickly.